Pilates video is for people with neuromuscular conditions to help support the exercises that you may have been given by your physiotherapist in your muscle clinic. It is important that you warm up prior to exercising. For example, if you have myocardial disease, ensure that you're in your second wind before starting these exercises. You may need to transition in and out of exercises if you have other conditions, for example, certain types of channelopathies. For conditions that cause fatigue, for example myasthenia, or where exercise may trigger symptoms, for example channelopathies, ensure that you do a low number of repetitions and you have enough rest break prior to each exercise. If you have any pain or discomfort, stop and seek advice from your physiotherapist. This is neutral spine and standing. So if you start with your feet together, you're going to take your toes out, then come up on your toes and heels out. So your feet are hip width apart. So you want your nice relaxed knees, okay? So you can have a slight bend in your knees, but making sure that your knees aren't pushed backwards. Then you're going to come up onto your hips, okay? So hands on your bony bits around your hip, and you're going to imagine that your pelvis is a bucket, okay? And you're going to empty the water out of that bucket and then tap it back in. So you're just going to rock your hips forwards and backwards. And then you're going to come to a point where you feel that your spine is nice and straight, that bucket is level, okay? Relax your arms, and you're going to find those core abdominal muscles. So again, you're thinking about a loose belt, a low slung belt. So you want to go onto sort of the third notch out of 10. So you're just slowly drawing your tummy muscles towards your spine. So from that position, you're then relaxing your shoulders. Okay, so you can take your shoulders up and then just let them relax down. You're thinking about your shoulder blades. So you want your shoulder blades to melt down into your back pockets and your collarbones to be nice and open. And then you're thinking about lengthening your neck. So you're wanting to imagine that you've been pulled up by a helium balloon from the crown of your head, and you're standing up nice and tall. So right from your head all the way down to your feet. You can feel grounded in your feet. You can feel the floor through all your toes and your heel. Your shoulders are relaxed. You've pulled in your tummy muscles. You've engaged those core muscles, and your neck is long. So this is a modification. So if you find that just standing is quite difficult, you can use a wall or a mirror for feedback. So if you're using a wall, we're going to start with your feet. So your feet are all the way back against the wall. Okay? And then you want your hips against the wall as well. Make sure that your knees aren't pressing against the wall. So your hips against the wall, shoulders back against the wall, engaging that core. So you're going to be straight and long through your neck. So you might find that your head is against the wall as well. Okay, and you're getting that feedback that you're nice and straight and neutral from all those different points on the wall. This is leg lifts. So again, we're going to stand in our neutral position up against a wall for the feedback. So nice neutral spine. And what we're going to do in this position is we're going to lift one leg up and then back down. So we're aiming for about hip height as you lift your leg up. So as you do this position, you're trying to keep your hips nice and level. So you don't want your hips dipping as you do this exercise. So lifting up and back down. Okay. And from there, we're going to go and lift our leg out to the side. So you're going to lift your leg out to the side and back down. And again, standing up tall on your stationary leg. This is the calf stretch. So you're going to step forward with one leg and you're going to bend your front knee. So what you want to make sure is that your feet are forward, okay? So especially that back heel, don't let it turn in, and you're going to bend your knee forward. You can use the wall for support if you need to, and just hold that position. So no bouncing, just holding that position nice and statically. And you should feel it in your back calf. So the back leg and your calf, you should feel a stretch. Okay, and you want to hold it for about 30 seconds, and then come back up into standing. And then you're going to take one foot back, not as far. That's it, feet flat on the floor, and you want to bend both your knees. Okay, and so this stretch gets your lower calf muscle. So again, you want your feet pointing forward as you're doing it. You can hold on to the wall for support. Again, holding on for 30 seconds, and then coming up. So this is a foot series. So starting again, standing in neutral spine. We're going to do the full movement first, and then we can break it down. So the full movement is going into a squat, so holding on as you need to, lifting your heels up, and then coming up on your toes, and then back down. Okay, so it's going into a squat, lifting your heels up, coming back up, and going down. So use something to support if you need to support your balance. If that feels quite challenging, then you can just go up on your toes and back down. So again, keeping that neutral spine, keeping your tummy tucked in as you do it. Up on your toes and back down. Or you could do little squats. So again, you just keep your feet flat, and you can go down into squats and then back up. So you want to imagine that you're going to sit on a chair and then squeeze your bottom as you come back up. You don't want to go down too far, but you're imagining you're sitting on a chair and squeezing as you come back up. This is hip dips. So this can be done on a step with a banister in front of you or to the side. So if you come and step up onto the block, so 1 foot at a time onto the block. Okay, so you want to find your neutral position, neutral spine, nice and tall. Okay, you can hold onto the chair, so just light fingertips on the chest. Don't press on the chair too hard. And with this position, you're going to have one hand on your hip. You're going to drop your right hip down off the step, and then you're going to bring it back up. So you're going to drop your right hip off the step and bring it back up. So you should start to feel it in your left hip. You'll feel that left hip working. You're standing up nice and tall through that left hip. Drop down, and then coming back up.